Good morning. I'd like to welcome everyone to the inaugural Dental Innovations Network Quick Chat. My name is Bill Neumann and I'll be your host today. And just to give you a little background on what a quick chat is, we should be finished in between 10 and 15 minutes. Quick chat is designed to learn about new clinical procedures, new product innovation, and then also dental marketing solutions. Since this is a quick chat, we're going to get right to our first inaugural guest, Dr. Apolinar Madrigal. Thanks, Doctor, for being here today.
Thank you. It's always nice to see you and share a little bit of the cases that we've done.
Yeah, this is gonna be a lot of fun. I'll give you a little bit of background on Dr. Madrigal. He is, well, first off, he's famous on Instagram. So if you want to check him out on Instagram, he has a huge following. But he is a general dentist who operates dental practices in both California and in Mexico. He graduated with honors from the University of Salle School of Dentistry in Leon, Mexico, where he earned his Doctorate of Dental Science. He is a faculty member of the American Academy of Implant Dentistry and a member of the American Academy of Cosmetic Dentistry. Dr. Madrigal is a recognized lecturer who presents both internationally and domestically on a myriad of subjects, including implant dentistry, laser technology, clinical photography, and minimally invasive veneers. He believes that paying attention to detail is what separates good from great cases. So again, thanks for being here.
Thank you. Thank you for having me. I don't know if I would say famous on Instagram, but
I was pretty impressed. So since this is a quick chat, we're going to jump right into the first slide. So question for you, Dr. Madrigal, on in this case right here, what did you do to restore this tooth? And then in particular, talk about the materials and why you chose them.
Sure. So this patient was actually referred to me, or the patient was referred to get that tooth extracted and get an implant placed. But we did have quite a bit of tooth structure left. That tooth had previously been treated with the root canal therapy. So that's why we have so much discoloration, but really didn't have much decay. So we wanted to actually restore that tooth without extracting it. And since we did have the capacity to do that based on the structure that we still had left of healthy tooth, we actually decided to just restore it. But we needed to make sure that we use a material that would cover up that grayness and that darkness of the tooth. So we did two things. The first thing that we did was we actually did tooth bleaching or teeth bleaching, teeth whitening on all the other teeth because the patient wanted to have a wider smile. After that, we wanted to make sure that we covered up the grayness. So to cover up that grayness, we need to make sure that we use a material that's going to be more opaque. So if we use something like lithium disilicate or Emax, it wasn't going to be able to cover it up. So we wanted to use zirconia in this case because zirconia wasn't going to let that light pass through and it wasn't going to show that grayness because the last thing the patient wanted was to have that dark line in the gingiva or have that tooth just be darker than the rest. So with zirconia, we were actually able to mask that quite well.
Excellent. So as we move on to this next slide here, I just want to mention something which I should have mentioned at the beginning. If you have any because this is a quick chat format, if you have any questions, we won't be able to necessarily answer them during this quick chat. However, you can place those in that little bubble you see there where it says Q&A. And what we can do is respond afterwards. So make sure if you do have any questions during the presentation, just ask the question. Again, won't be able to answer them now, but we can certainly take care of that after the fact. So we'll make sure we get everything answered for you. Dr. Madrigal will, or someone from DenMat will be able to answer that. So moving on to this next slide here, let's talk a little bit about the post being removed. So questions on this. Did you replace the post? And talk a little bit about the decision there.
All right. So in this case, again, we did a retreatment on the tooth since the tooth had been exposed for quite a bit. We didn't want to, we know that the inside of that tooth already has bacteria. So we want to make sure that we take all that out and we actually replace the gutta percha material to give that tooth a longer chance of survival. We did not replace the post because we have enough ferrule effect right there. We have actually over 2 millimeters all the way around of healthy tooth structure. So really the post wasn't going to do us any benefit here. I know there's a lot of controversy here with posts or no posts, but the data is really showing that whenever we have a failure of a tooth that's treated with a post, it's more than likely going to be catastrophic, meaning that the tooth cannot be restored any longer. So if we avoid having or placing posts, especially metal posts, we can actually give that tooth a little bit more of a chance of survival long term.
Excellent. So since you weren't using a post, so talk about the build-up material that you're using and why you chose it.
Sure. So buildups can be done previously they were done with amalgams, later on with composites. And now we've modified that to actually having a dual cure composite. So here in this case, I used core paste, which is a dual cure stackable composite. And the reason why I chose to do that was since it's so deep down in that cavity where we have that post that was taken out, we want something that's not going to have so much contraction. And also something that's going to be dual cured to make sure that it's polymerized or cured all the way through. So using a dual cure composite gives us that opportunity to make sure that everything's cured all the way and that we don't have that contraction factor too. It's going to adapt very well to all the walls, so it's still flowable, but it's also stackable, which means that we can actually build up the tooth, and it's going to make it a lot easier for us to let it cure and then actually prep around that to receive the crown. Great.
Ideas on the length of time it takes for it to cure completely on its own?
So it takes about 2 minutes if you let it cure completely, from 90 seconds to 2 minutes. If you want it to go a little bit faster, you can always just hit it with the light and polymerize it faster. It's not going to affect the properties at all.
Excellent. Okay. So what are we used? So we're preparing for bonding. Let's talk a little bit about this.
Yeah. So right here, I whenever I can, I prefer to bond rather than just cement my restorations. But in order to bond, we want to make sure that we have a very clean surface. So when we're cementing, we really just have mechanical retention. When we're bonding, we have both mechanical and chemical retention. So it gives us a stronger bond or stronger hold of that restoration to our tooth or our buildup. While we're bonding, we want to make sure that everything's nice and clean. So in most cases, I like using a sandblaster. In this case, it's the Zest Prep Start H2O, which gives us a very clean surface to make sure that there's no residue there. And we were able to just etch and bond afterwards, and we're going to be able to have a very good chemical bond to that tooth.
Excellent. So in this picture here, we see cement. So let's talk a little bit about the cementation process and what type of cement you use.
So I really 90% of the cases that we do now are being cemented or bonded with a dual cure cement, which actually turns into a gel in about 30 seconds to a minute. So it allows for very easy removal. Especially when you're using a very opaque restoration like zirconia, you want to make sure that it's dual cure because the light won't be able to go through all the way. So by using this dual cure cement, we know that everything's going to be completely cured underneath that restoration. And then at the same time, it's going to give us time to remove the excess with just an Explorer. It just comes right off since it's in that gel form. And it gives you enough time to clean it out to where you're not going to have to be waiting later on or having to deal with the floss or with a little seri sauce to move any interproximal cement because it comes off really, really easily. So that's really what we like using for, again, 90% of the cases now.
The dual cure cement. And how long is it in that elastic form where you can just kind of pull it off? You don't have to worry about hitting it with a burr to remove it.
It's about a minute. You have about a minute to work with it. It's plenty of time. What you do want is to make sure that you're not hitting. If you're using loops and you have your light on, if it's really strong, you either want to put that orange filter on or just dim it down, because again, it's a dual cure, which means it's going to both auto cure or self cure, and it's also going to cure with any light source. So if you're shooting a straight, strong light at it, it's going to cure a lot faster. So usually I just dim my light down a little bit, and then I'm able to just play with it and just remove all the cement. But it's plenty of time.
Excellent. Well, great. I mean, that's what we call a quick chat, right? I think we hit everything in just a little over 10 minutes. And we're going to finish things up here. And like I mentioned earlier, if you do have any questions, we really don't have the time to answer them now, but we will follow up with everyone via email. So if there's any questions, you can just type the question in the Q&A area, and we will get back to you. Here's the final restoration. So take a look at that. It looks great. I don't know if you have any final points on this, Dr. Madrigal, before we talk about the next quick chat.
No, just like what you said, if anyone does have any questions, feel free to either do it with the little box that Bill just said, or you can also shoot me a message through Instagram. I'm usually pretty quick at replying at those. We can see that just choosing or planning the right case, planning the right materials can give you really good results. So not every case is going to be different. So materials do matter. Choosing the right restorations is going to give you a great outcome at the end of the day.
It seems like the theme of this quick chat was dual cure materials.
Yeah. I mean, I love those.
And it's great. It's great case, great presentation. Really appreciate it, Dr. Madrigal. It's great that we had you as the inaugural guest on the Dental Innovation Network here. So we're going to be doing these twice a month. And so the next event will be on April the 28th. That's 8 a.m. Pacific, 11 a.m. on the East Coast. And as far as who we actually are going to have on the next Dental Innovation Network Quick Chat, we're going to have Dr. Peter Harnoy. And Dr. Harnoy is going to talk about the methods that he uses to obtain more patients and gain treatment acceptance through his marketing solutions. So that'll be on the 28th, and we appreciate DenMat for hosting this. I appreciate, again, Dr. Madrigal for being here, and all you attendees for getting up early and listening to what we have to say. So until next time, I'm Bill Neumann, and we appreciate you stopping by today.
Thanks, Bill.
Thanks, Dr. Madrigal.
Take care. Bye.